Doctor, I've been hearing a lot about low-carb diets lately. What exactly are they? Does it mean I shouldn't eat carbs at all?
A low-carb diet involves reducing foods high in carbohydrates, like rice, bread, and noodles. This helps stabilize blood sugar levels and can lead to weight loss. It's particularly effective for people with type 2 diabetes.
So, just cutting down on certain foods can lower blood sugar? That sounds pretty simple.
Yes, carbohydrates are the primary nutrient that raises blood sugar. When you eat a lot of carbs, your blood sugar spikes, prompting your body to release a large amount of insulin. This repeated cycle makes it harder to manage blood sugar. By reducing carbs, you can prevent these spikes and keep your blood sugar stable.
Does that mean the more I cut carbs, the better?
Not necessarily. Extreme carb reduction can have negative effects, like vitamin, mineral, and fiber deficiencies. It can also lead to fatigue and difficulty concentrating. Moderation is key.
I see. So, how much should I reduce my carbs?
Generally, around 130 g of carbs per day is a good starting point. That's about 2.5 medium-sized bowls of rice or 5 slices of bread. This amount is manageable, sustainable, and allows for balanced nutrition. Of course, the ideal amount can vary based on individual metabolism and body size, so adjust according to your needs.
That sounds doable. But I'm worried about nutritional imbalances.
That's a valid concern. The first point to keep in mind is that reducing carbs should go hand in hand with maintaining balanced nutrition. Eating plenty of vegetables and fruits ensures you get enough vitamins and fiber, which also helps prevent constipation and supports overall health.
I didn't realize fiber was so important. Are there any problems if I cut too many carbs?
Yes, and this leads to the second point: avoid extreme carb restriction. Doing so can cause fatigue, increase the risk of rebound weight gain, and make it harder to stick with the diet. Gradual, moderate reductions are the key to long-term success.
Rebound weight gain sounds scary. It feels like all the effort would go to waste.
Exactly. Gradual reductions and balanced meals allow you to manage your weight and health without those risks.
It still sounds a bit challenging, but I think I'd like to try. I'm just a bit nervous about getting it right.
That's completely understandable. Let's go over specific food choices next to make the process easier for you.
Yes, please. I'm not sure what to eat or how to approach this.
Focus on low-carb foods like legumes, vegetables, and nuts. For snacks, try options like nuts, cheese, or boiled eggs.
Legumes sound healthy, but which ones should I choose?
Edamame and nuts are excellent low-carb options. However, chickpeas and lentils are slightly higher in carbs, so consume them in moderation. When eating out, opt for salads, grilled chicken, or tofu dishes that are low in carbs.
That's helpful. I didn't realize there were low-carb options for eating out. What about vegetables?
Vegetables like broccoli, spinach, and cabbage are great choices because they are low in starch. Also, healthy fats like olive oil and flaxseed oil are beneficial. They can lower bad cholesterol levels in your blood.
So, I need healthy fats too? Balancing all this seems tricky.
It might seem challenging at first, but as you start making these choices, it becomes easier. Reducing high-carb foods while incorporating vegetables, fish, and nuts naturally leads to better balance.
That's reassuring. I'll give it a try, but I'm still a bit nervous about staying on track.
That's completely fine. Start small and take steps at your own pace. If you're ever unsure, feel free to ask for help.
Thank you, doctor. I'm worried about rebound weight gain, but I'll do my best.
Remember, rebound weight gain is more likely with extreme restrictions or sudden changes. By reducing carbs gradually and working at your own pace, you'll minimize the risk.
So, slow and steady wins the race. That makes sense.
Exactly. Success comes from steady, consistent progress. Focus on your health and take it step by step.
Could you summarize everything we talked about today?
Of course. The first key point is to practice moderate carb restriction while maintaining nutritional balance. This means reducing carbs while ensuring you get enough vitamins and fiber from vegetables and fruits. The second key point is to avoid extreme restrictions. Gradual reductions help prevent rebound weight gain and make the diet sustainable in the long term. With these steps, you can achieve a healthy and balanced approach.
Thank you, doctor. I think I can handle this. I'll give it my best shot.
That's the spirit. Take your time and prioritize your health. If you need any advice along the way, don't hesitate to reach out.